Hey, welcome back, everybody. It's time again for another episode of Health Talks with Dr. Trinh. The one show, maybe the only show that shows you the path to a healthier life, one conversation at a time. And today, well, we're going to have many conversations going. It's a free-flowing, open forum this morning with a couple of topics we're going to talk about with Dr. Trinh, who's got a lot on his mind this morning here.
Morning.
Good morning.
How are you?
Well, let's just catch up real quickly. A quick shout out to your son who went through the first phase of officer training in the Marine Corps. Talk about that for a second. You were back at Quantico.
Yeah. He is, we just went to the East Coast and did a little graduation for him. Graduated from infantry training as an officer, and now has to go on to his specialty training.
Specialty training, light armor reconnaissance. That's the next step. All right, I'll tell you what's interesting about this, and this will tie into last week.
Right.
We tend to think of young people as lazy. They're not committed in the same way we were as kids. I grew up in the 60s, a little older, and we were out protesting the war. We were committed to change the world. We were going to be activists, and we joined the Peace Corps and all sorts of things. That narrative is kind of stuck, that today's youth are slackers, hackers, whatever. They're not concerned with anything but themselves. Your son proves otherwise. The young lady who was on last week proves otherwise, who drops everything, a cushy job in London, to go back to her roots. Strangely enough, she's raised as an immigrant in Poland, not here in the United States. When her family fled the Vietnam War, they didn't come to the United States, they came to Poland. And apparently many others did too, to the Eastern Bloc countries, especially from the North. The North Vietnamese went to their allies. We took our allies in here in the South. And the proof is in the pudding. These people have put themselves on the line. Your son didn't. This wasn't like he had no other choice. He graduated from, what was it, UC Santa Barbara or someplace.
Yeah, that's right.
He had a cushy life ahead. Why do these people put that on hold or put that aside to go serve others? I'm flabbergasted.
It's probably an idea of the fact that there's something bigger than ourselves.
I believed it, but did they believe it?
Yes, believed it enough to participate.
You had some other young man on a few months ago, and he was a missionary from Orange County. He's in Africa. Kenya.
Yeah, that's Caleb. He's in Kenya now. That's right. Something bigger than ourselves.
So that seemed like a message of the 60s. Has it come back around to the 2020s here? Are more of the youth thinking of others than I think?
Yeah, or maybe they have maybe they look around and they see that there's got to be something more than just getting a job.
Well, that's a pretty bold statement, because for most of them it was just getting a job, getting a career, getting the job. Now let's talk about the Great Resignation, and then we'll get back to COVID, because I know that's where you want to go here. The Great Resignation has got many people rethinking, is that all there is? Am I really doing what I should be doing? Life is short. Maybe I should be rethinking, resigning, redoing.
Right.
What do you think about that? Or is it all tied together, this kind of idea?
I think being cooped up and shut down and at home gave people time to think. And I think, with that time to think, it really allowed them to kind of figure out what's really important.
Yes.
And with that, it's more than just a job and trying to grow a bank account, right?
Yeah. Right.
Well,
if that really sticks, if that stays, if that isn't just a temporary thing, that is a major major change in the way we've been going, because for too long it's been about me, and more money and more everything. And suddenly
Hmm.
people are suddenly saying maybe there's more to it than that.
Yes, absolutely, absolutely. And Americans are really generous. Just looking at the type of support nationally for those maybe in Ukraine,
Yeah.
those who don't speak their language, those who are half the world away, and so it leads me to believe that in general we do believe that there's something more than just a job in our pocketbook.
Do we
I
have an
was
obligation to others, particularly others we don't even know?
Yes, yes. I don't know if you had a chance to see the president of Ukraine's speech to Congress 2 days ago.
Minutes of it, just the highlights.
It was the first time that I believe in a long time that Republicans and Democrats agreed.
Yeah. And stood
Think
up
about that.
100%. Every one of them stood up and gave him a standing ovation.
It was the first time, and I was like, wow, I've never seen this type of unity in the last, I don't know, 8, 10, 12 years among the House
I
and
saw
Congress.
that in the president's State of the Union address too, which is always a very politicized thing, more so than ever the last 3 or 4 presidents. And so one side sits and one side stands and cheers all the time. But there were 2 or 3 moments in that State of the Union when they talked about Ukraine where both sides cheered, because
Yes,
for a moment they're putting aside the partisan differences and saying we as a country feel shocked by what's happening
right.
and feel compelled to stand up against this. That used to be taken for granted. We had a Cold War consensus that whether we liked each other or not, whether we thought the government should send more money or less money on welfare and social programs, we had a Cold War consensus that when it came to fighting the Soviet Union and communism, we were united on that front. We may disagree over the specifics, but no disagreement that we got to stand up to these, what Reagan called the evil empire, what
Right.
Bush called the axis of evil, what Kennedy famously said, ask not what your country's just doing for you, ask what you're doing for your country. This notion that we had to serve others. And we saw it in other ways in Haiti and stuff. I know you've been to Haiti and stuff
Mhm.
after the great earthquake there, where both former President Bush and former President Clinton came together.
Right.
One defeated the other, hardly people who are going to get along. And they came together and raised money for a good cause. There are moments when we, as Lincoln famously said, we listen to our better angels, not the devil
Yes.
standing on our shoulders.
It's nice to see that.
It
It's
is.
nice to see that we have values that are shared, whether you're, whatever your political background, there are certain just values of freedom, of peace, of values that exceed political, correct?
And
Yeah.
not to get off on a rant, I know I got a little bit of a rant last week. I'll avoid it this week. Is we are at a moment that I'm a big history buff. I was a history major. It reminds me of the 1920s, not the 2020s. The 1920s was the rise of what we now call autocrats, dictators, on both sides, fascism and communism. Stalin in Russia and Hitler and Mussolini in Europe here. 2 versions of authoritarian ideas that said, the
Right.
people, listen to us. Somebody will tell you what to do. Somebody will tell you how to think. Somebody will take control of this. A strong person, usually a party, the Communist Party, the Nazi Party, the Fascist Party, whatever. And you're supposed to sacrifice everything. And today it's in China. You see this. It's
Yes.
all for one. Individual ideas and freedom are gone. It's somebody's in charge, and they'll tell everybody how to think, how to act, what to do, and that's somehow better for society. I think we're testing that whole idea again around the world.
Absolutely, absolutely, and thanks to your show, we've gotten the word out on what's going on in Ukraine and opportunities to help.
Do we want to shout out, give any? I don't know if you want to be self-serving enough to say how much you
Yeah,
raised.
I see folks here on who's with us now on Facebook, and they're watching, and they have sent in donations.
I sent in $50. I really did, folks. I went to PayPal and said, I know it's not a lot, but I thought if we had 10
every dollar
people,
counts.
yeah, if we had
Every
10
dollar
people,
counts.
10 people do that. But you raised more than that. Do you want to talk about that, or is that just
shout out to Eric and Chris Kodama. I know they're watching now. Thank you so much for your contribution, and we have a good number of contribution. Mary helped out. Our largest donor is Candy Kim's network and family, who sent in a large sum of
multi-thousands. I don't know if you wanted to say it.
Multi-thousands,
yeah, right.
And all that went out yesterday to our partner in Poland, who we brought on last week. So we sent in close to about 13K through Tongue Out.
There you go.
Through Tongue Out.
And
so thank you, Chris.
So thank you to everybody who gave. What is it? What is it about this crisis? And your guest last week brought that up, and it was kind of a little awkward, almost embarrassing moment when she said, and I had to acknowledge, what is different about this time? Did we respond the same way when Syria was being bombed into submission by Assad and Putin, to try and flattening cities like they're doing in Ukraine now, and refugees flooded out of the country? Instead, Europe kind of said, hey, we're really sorry, but stay where you are. Now we're in 2.5 million Ukrainians have left, and we seem to be responding differently.
Yes, it's very interesting looking at that. Perhaps we are not as close to Syrians as we are to Europeans, maybe.
Right.
Could that be a reason? And so maybe we're less emotionally connected to certain countries than other countries, is my assumption.
And I'll go one step further. I do think this was sort of a slap in the face, a wake-up call in that sense, that we thought these days were gone. We're dictators, we're authoritarian thugs, would just roll the tanks across the border and seize countries, as we saw throughout the 1900s. We thought this is so yesterday.
Sure.
Yeah, this is not something we're going to see anymore. Assad was a civil war in Syria and trying to bomb his own people to squash the civil war. This is an outright war where one country invades another for not really any apparent good reason that they can come up with. They weren't under threat.
Nope.
They weren't being attacked. They weren't being even called names or anything here. They simply wanted it, and they decided to take it. Pretty bold, pretty brazen, just aggression. And that used to happen a lot. And, you know, occasionally we responded when Saddam Hussein invaded, the first time when he invaded Kuwait, the world responded. Yes. It reminds me of that under Republican regime that time. Same thing. George Bush Sr., I think, because he'd been vice president and been CIA director, had massive connections in the European and the foreign relations world, just as Biden has. We seem to have, whether you like Biden or not, he seems to be the right guy at the right moment for this crisis, I think, I'm going to say, because of his 25 years of experience. He knows these people. He knows how they think. They know him. He knows how to get them on the phone in the same way that George Bush Sr. knew these people. And whether it was Trump or Obama, neither, because they weren't versed in foreign affairs, they didn't have that 25 years of connections and understanding of these people here. We tend not to elect people in this country who have foreign policy experience. We don't think that's important until it is. Yeah,
it's not a high thing on our priority list, is it?
Yeah, and then all of a sudden, once in a while, a world crisis comes up, and in both George Bush Sr. and Biden's case, you got somebody who has a long resume in there. Whether you like what he's doing or not, they have they understand the situation immediately because they've been there.
Absolutely.
All right. Well, what
So,
where we've also been, which I guess is today's program here, not just sort of
uh,
a pat on the back to say, hey, maybe America's back and we're thinking of the world again and thinking of each other. What do you think of COVID? I thought COVID's done. Masks are coming down. Whew, it's
yeah.
over. We made it. And all of a
Seems
sudden, whoops, maybe not so fast.
it's maybe emotionally done for many Americans, whether it's done or not.
Yeah,
Most of us are emotionally done with COVID,
I think so.
right? Masks are down. Yeah, it's off the news. The but what I'm seeing something in Asia and in Europe that's raising the alarm a little bit.
Okay. And I read this too. South Korea's got record numbers. China's shutting some cities down again here. And
Yeah, it's so so what we're seeing is that in the past few weeks, the United Kingdom, England, Germany, France, China, they're starting to see this wave that's coming back. And the question is, what is it?
what is it?
Is it
Is it a new
so?
variant? Is it a variation of the old variant? Yeah.
Yes. So what it is that it is Omicron baby.
Omicron baby. They got to give it a new name. It's the baby of Omicron.
Omicron baby. That's my name.
All
That's the
right.
name I give for it.
Okay. I like it.
And Omicron baby is probably 80 to 90% more contagious than Omicron.
Oh, you're kidding. I thought Omicron was the super contagious bug. This one's even more,
Yes, so Omicron is super contagious compared to Delta.
right?
And so now we have Omicron baby, which is almost 89% more contagious than Omicron. So it's crazy when you think about it. But that's the way variants and mutations, that's the way they evolve because they're evolving to become better than the prior
Yeah.
original
Constantly. They want
mother.
to survive. And as
Survive.
yeah, the law of survival.
That's right.
So let's wrap our head around this. Is there a chance? Well, let me ask three questions, and then if your audience has questions, because they probably have more than I do. One, we always assume that and this, I know this is not the flu, but
Mhm.
it's something sort of, at least to me and many of us, sort of like the flu. It's a contagious respiratory disease of some sort. And is it in
Right.
the same family as the flu, or is it the family of a cold? I always forget. I always get the two confused. Is it more like a cold or more like a flu? Is the what you tell me the technical term for this? They're sort of generic families that these viruses live in. Is this
Right.
more the flu family or the cold family that coronavirus came out of? I don't know.
Neither.
Neither. Okay.
Neither. Absolutely nothing close to the flu or the cold. The coronavirus is not the flu. It is not a bad flu. Coronavirus causes, in the last 2 years, around close to 1 million American deaths in the last 2 years. The flu does not even come close to that, does it?
No, but I'm just saying it. Where does
Yeah.
where does this coronavirus live? Is what family of viruses is it in? Is it more like a flu virus or more like a? Where does it come out of? If I had to
So,
relate it to something,
so it's a large family that does include the common cold. The common cold is a coronavirus as well. But this specific COVID-19 is nothing like the common cold
no.
in that it is a infection that affects the vascular system much more. It causes blood clotting,
Yeah.
which isn't something we see in the common cold or the flu. It causes vascular issues through inflammation.
Right.
Is what COVID-19 is.
And
So
and
it's completely
just
separate.
and you guys have talked many episodes about this. I'll just see if I understand it correctly. That as
Right.
long as it stays in your upper respiratory system, in your head, in your nose, in your nasal passages,
Mhm.
the risks are lower. When it gets out of your nose and into your lungs, should it migrate into your lungs, bad things happen, blood clots happen, oxygen levels drop, trouble breathing, and that's where it becomes very quickly potentially dangerous or deadly. It's that transition from the other. And you had the guy on who I knew you're doing some work with him, the guy from, is it Fend?
Yeah. David Edwards, professor at Harvard University, and comes out with a product called Hello Fen, which is, I wonder if I have one of these around here, which is
it's a little inhaler kind of thing.
A salt spray, right? That is designed to hydrate your upper airway.
So you can expel this, so you can get rid of it before it goes into your lungs.
You can expel it, exactly, to minimize the risk for not just infections like COVID, but the risk for just toxins and air pollutions and other stuff through airway hydration.
And then
somewhere.
All right, so and that's still going along, and there are people that are still trying to find ways to minimize it. What was the other? It's not Tamiflu. I know that's a day of flu, but what's the other one that was approved by one of the drug companies to help, again, a treatment? What was it called?
There are several medications, pills that are FDA approved, specific for COVID-19. These pills need to be taken within the first few days of infection for it to be effective, just similar to Tamiflu. And typically is given during the first few days, like 5 days, like a 5-day course or something like that.
And what do they do? Do they help keep it from migrating? Do they help expel it? What do they do to minimize the risk?
They block, they're antivirals is what they are. Similar to Tamiflu, except these are antivirals that are designed for COVID-19. In the clinical trials that are done, taking these medications appropriately in the right patients at the right time will cut down hospitalization by at least 80%.
So again, it doesn't keep you from getting sick. It just makes the sick go away quicker and less
much more mild.
Yeah.
Yes, exactly.
So isn't that where most Americans mentally are at right now? I not going to do anything. I'm done wearing masks. I'm done trying to figure out how to do this. I may not even take any more boosters or shots or whatever. I'm just done. And if I get it, I'm going to take a pill, and it's going to be a bad flu. It's going to be a bad cold. It's just going to be something, and I'll ride it out and get back to work. But it's not worth shutting down the economy. It's not worth shutting down my life. It's not worth changing anything anymore. I'm just done with it. I did everything you asked, and it's still here, and I'm not going to worry about it anymore. Is that what most
Yes,
people
I am. Yeah, that's kind of the mentality that currently exists. It's that I'm tired. I don't want to be shut down. I want to live life. And yes, COVID may be here, but I don't want to be shut down again.
Not worrying about it anymore here. I
can totally relate with that. I don't think any one of us want to be shut down again.
But is that realistic, or will we be shut down? Should these variants start to take off again, as they did in December, and suddenly everybody, let's put the mask back in. Oops. In fact, we even tried to do mandatory. I'll be shocked. Everybody's going to light up their thing here. I was one of those said early on, I would welcome the idea of vaccine passports and stuff that prove, you can come into the restaurant, you can go on the plane, you can go in the concert, but show me you got a vaccine first, and then we'll let you in. This mandatory vaccination thing that the federal government tried to put in place, and very angry response went all the way to the Supreme Court. Supreme Court said, in a very confusing decision to me, they said that that OSHA, that was in charge of worker safety, could not impose mandatory mandates on employers over 100 people. Couldn't do that to prevent worker safety. But that OSHA, Health and Human Services that oversees hospitals, yes, hospitals could make everybody get a vaccine mandate, but businesses couldn't.
Right.
I don't understand the logic of that, but I know that people cheered. My social media lit up, and when I responded back and said, well, what are we cheering about? We're cheering about the fact that we're going to let people continue to live unvaccinated, and isn't that going to let this thing keep percolating and changing? How is that a victory? And everybody's, oh, because it's oppressive and the government can't tell you what to do and it's my personal choice. Well, yeah, but if your personal choice means that the bug keeps living and I have to be in danger because you don't want to get a vaccine, I don't know that that's a good answer.
It's different values, and we all we all may have the same list of values, but we all don't have the same values priority. And so your number one value may not be another person's number one value.
And I'll go one step further, and maybe this will provoke some reaction here on Facebook today. It goes back to what we first said. I'm as independent as the next guy. I'm as libertarian as any Orange County. Don't tell me what to do. I live my own life. I dress the way I want. I'm an old hippie. You can't tell me what to do. Right. Having said that, though, I understand and believe we have a responsibility to others because I'm a good Catholic here, too. And so having said that, I think that you can be an independent, but you do have an obligation to others. I live my life the way I want. Don't tell me what to do, but I have an obligation to at certain times to band together and do. And maybe that means I got to pay taxes. Maybe that means I got to be nice to people when I don't. Maybe that means I got to come out of pocket and give some money to Ukrainians that I don't even know. But there is a certain moral obligation I have to others for to help others. That, to me, was what was missing in the vaccine debate. I know you may not like it, but if we all do it, won't this thing go away? Because the truth is, if everybody got vaccinated tomorrow, 100% of the people, or got the disease tomorrow, one or the other. We also had a big party where I got sick, like a measles party here.
Yes.
The bug would die because it would have nowhere to go. It would have no open hosts to grab.
Yeah, you're right. Absolutely.
And yet we seem to say it's individual choice, and it is, but that individual choice doesn't think about anybody but me.
It's why 1 million Americans have died in the last 2 years.
1 million. Now, here's the shocking thing. I'll ask people on your thing. How many people on your social media feed today think that's true? Because I talk to people all the time and said, that's not true. That's just baloney. They pay the doctor to put COVID in there because they get a little bonus. These people would have died anyway. This COVID was just like saying they also had a hangnail and they all died. They didn't die because of the hangnail, but they all had a hangnail, and you're going to say that's why they all died, or they all had a cold. I'm telling you, a lot of people don't believe what you just said, that 1 million people died. A lot of them don't.
Yeah, well, everyone can believe whatever news that poisons their brain.
Yeah.
Right. The truth is relative these days because we are also living in our own tribe.
Yes.
And that tribe only feeds us the information we want to hear.
I'm going to let you vamp on that for a second because I got to go run. I got to answer the door here real quickly. But
you answer the door.
You talk about that because I think that is the issue that's facing us going forward. Are we going to do this together as one tribe like we are in Ukraine? Or are we going to go back to, I don't care if it makes you sick. I don't care worrying about you. I'm going to do what I want to do. Talk about that.
Oh yeah, definitely go answer the door. But yes, we unfortunately we only watch the news that we believe in, and we don't go outside of our tribe, and we don't go outside of our the information we're fed. So the information we're fed is very narrow. It's filtered to tell a story that we believe in. And that is why we have 2 or 3 Americas these days, as opposed to one. But what you should know about this this rise in COVID that we're seeing in Europe is this. There's a few things you should know. First of all, whatever happens in Europe doesn't stay in Europe. Whatever happened in Europe ends up in the United States a month later. So it's always good to see what's going on over there because a month later it will be here. Okay. So what is going on in Europe? We know that the latest variant is, by lack of a better word, I'm just going to call it Omicron baby, right? The offshoot of Omicron. We know that there are at least 12 countries geographically, extending from Finland to Greece, that are experiencing new cases right now. Some quite really high. For example, Austria have exceeded their pandemic peak as far as cases. Finland has an 85% increase in cases compared to the prior week in Finland. Many of these countries are also showing a rise in hospital admissions as well.
So what are we going to do about it? Are we ready to rally?
We're doing nothing about it right now because we are tired of COVID.
Yeah, right. That's my whole point. I just don't know. Even if it spikes way back up again, I don't know that anybody will believe it. I don't know anybody that'll do anything about it. And if they do, and if people try and force them, businesses, governments, others, I think there'll be, as we've seen already, rallies.
Yeah. And you know what's interesting? The way that we know that this is coming is that we are seeing a rise in detecting COVID in wastewater. Wastewater, toilet water.
Talk about that. I didn't know we were monitoring wastewater.
We are wastewater surveillance is something that we monitor. There was a study conducted between February 24th to March 10th, 2022, and where they checked about 15% of the 410 sites of wastewater that's there. And what they've shown between February 10th to March 20 to February 24th to March 10th is that they showed a 1,000% increase in the detection of this new variant, BA.2 variant, prior to the 15 days prior. So they did a baseline looking for the variant in wastewater, and then they came back to the wastewater 15 days later and looked for the same variant. And they detected in the wastewater a 1,000% increase in this variant in the wastewater.
So I want to ask everybody on Facebook right now. I don't know how many people are there. I don't have it in front of me right in the moment. But whoever's there, I want you to type in right now, answer to this question. If it rises, if it rears its ugly head again, a new variant starts spreading, everything Dr. Trinh says is true, and it comes here to us again, would you put your mask back on, and would you get another booster?
Yeah. Good question. So it's very interesting, right? 15-day period, 1,000% increase in the wastewater. And the wastewater is something that shows up before the real infections show up, before the symptoms show up.
Because you're peeing this stuff out and whatever, and they're monitoring. Because here's what I understand, and I didn't. We're going to have somebody from Waste Management on in a couple of weeks. I'm going to ask him this question, not on your show, but on another show.
Right.
They have to manage. They have to look at your waste that comes into the system because they got to dispose of it somehow, right? And a lot of it they try and recycle. They try and run it through all these ponds and algae and filters and everything else like that, so that they can at least use it for irrigation water.
Right.
So that those purple pipes that you see here in Orange County everywhere. So they take your poop and your pee and all this other waste, and they try, because what are we going to do with it? We can't dump it in the ocean. We can't just dig a hole and bury it. So they try and recycle it. And that means that they try and strip a lot of it out. And in so doing, they have to measure it to see whether it's safe. So I didn't know that they're really measuring this stuff as carefully as it is. Another
Yes.
another
Yes.
big government watching me here. Oh, now you're watching my pee. But they have been doing this for quite some time, not looking for COVID, to see if the
Mhm.
water's safe to use for other purposes. And in so doing, somebody said, well, why don't we just check and see if this little bug is in there? We're already got the monitoring in place. And apparently that's where they started monitoring this and adding one more thing they're checking. And they see that it's in your body because you're peeing it out. You don't even know you got it. And then a couple of weeks later, oops, there it is. There's a spike in cases. Those early indicators show us it was there in the population.
Yes, yes, yes. I can tell you that in the US, probably 64% of us have had our 2 shots. 64%. So 2 out of 3 Americans have had their 2 shots. And only 29% have had a booster. 1 out of 3 have had a booster.
So I'd like, again, let's do this as a little crowdsourcing. I don't know how many people, there's a bunch of people on right now. How many, I'd like to hear from somebody who did not get a vaccine, why they never got a vaccine. And if they did get a vaccine, I'd like to hear from the half of whom who didn't go get a booster. If you got the vaccine, why wouldn't you get the booster?
Whatever the case, HRSA, which is the funding arm of the government to fund for COVID care, where HRSA is where they provide the no cost, right? No cost if you're uninsured for your COVID shot, for COVID related care. HRSA funding ends March 22nd.
Oh, I didn't know that.
Starting March 22nd, if you are uninsured, you will not get your free shot or and I wouldn't say free because it's funded by the government, but that funding runs out March 22nd.
Wow.
Isn't that next week? It's March 17th today.
Yeah, right.
So
far I haven't heard
interesting.
So far I haven't heard from anybody on here why they have not gotten a booster. I really would like to know. I'm not trying to shame people, but I'd like
So it's
to
very
know.
interesting what's going to happen with this. It's a critical issue. But the real question is, how serious is Omicron baby? Is it going to land you in the hospital, or is it super mild where we shouldn't worry about it despite the fact that the cases are going up? Right. So that's the real question. Am I going to see more patients in the ER when I'm in the ER in the next month in April? And I'll be able to tell you. So that data is relatively early to know because typically hospitalization follows new cases by about a month. 3 to 4 weeks later, right? So you get your new cases now and you try to handle it at home for the next 2 weeks and things get worse and you can't handle it anymore. So by week, 3 to 4, then you're in the ER.
Right.
So that's, and because Omicron baby is still relatively, just landing in the United States within the last, week, 2 weeks or so, few weeks that we can detect. It's going to be probably another 3-4 weeks. So sometime in April, we're going to see the effect of this, and we'll know for sure how serious it is.
All right, here's what's, again, somebody laughed and said the other day, I'm here at the University of California, Irvine on campus at the Beal Applied Innovation Center. You're a Wayfinder mentor over here. You're familiar with the building here. Mm-hmm. And we were among the last. We're going to drop our mandatory mask wearing next week. This weekend, this is the last week they're asking everybody to wear a mask to come in, insisting that everybody wear a mask to come in, not asking.
Right.
And then afterwards it becomes voluntary. And somebody laughed and said, oh, so I guess it's over. We won. The bug's gone. And now Dr. Trinh saying, the minute we're dropping our defenses, the minute we're dropping our masks, there is another wave that could be rushing our way.
Absolutely. Absolutely. Omicron baby. And so it's in Europe right now. It's in Asia. It's the reason why China locked down recently.
Yeah.
This past week. It is the reason why China locked down. And again, what happens in Europe doesn't stay in Europe. Give us a month.
Yeah, as we've seen with Ukraine and other things. What stays in Europe doesn't stay in Europe. All right, so I still am struggling, though. Nobody's answered my question. I think
Okay.
nobody will tell me what, if this hits again, are we ready for lockdowns? Are we ready for masks? Are we ready for new boosters? Are we ready to do any of those measures, or are we just done with it? I don't care if it kills another 10 million people. I ain't doing nothing. No more.
It's a good question. It's a good question. We're going to find out soon with that. But super important if you haven't had your booster to definitely get this.
What about
even
this?
if
I was saying, what about this fourth shot or the so-called second booster? Pfizer, I just read this morning, is trying to get FDA approval for people over 60 or people at risk to authorize them to get yet another booster. What do you think that's coming?
Yeah.
What does that look like?
I think that's coming. The question is when, and the question is how long do you wait? Is it going to be a yearly booster? At a minimum, it's going to be yearly, right? At a minimum.
Right.
Nobody wants to get more than one shot a year for COVID, to tell you the truth. But we still have to follow the science. Right. What does the data show?
No, we don't. We can just say it's over and declare victory.
Yeah, we could. And well, I think that's what we're doing now.
I think that's exactly what we're doing now. We're just done. And so let's say it's over. We won. Hooray. And move on.
That's what we're doing now. But the wastewater tells something different.
All right. And, what about long haulers? I've read different confusing things about long haulers. Do we know any more about long haulers
We do. We know at least maybe 1 out of 5 developed long haulers.
Wow.
Okay. 15 to 20%. And long haulers could be something super mild as far as maybe just chronic fatigue. I don't know. I wouldn't call that mild, but it could be respiratory symptoms where you don't get your full breathing back for a long time, or you never get your taste and smell back. I know folks who've lost their taste and smell a year ago, and they still haven't gotten it back. Right? That's all part of long haulers.
Any studies yet on the long effect of COVID on your body? Does it hurt your lungs? Does it hurt your heart? Does it lead to more potential?
Yes, we have information on all that. We know that COVID increases the risk of heart disease months down the line. We know that obviously brain fog is something that's seen often with COVID. Especially even after COVID is gone, after the virus is gone, the brain fog remains.
Right.
We know that chronic pain is a big factor with COVID. When you get the flu, you have that just muscle aching and joint aches. We see that with COVID as well, and that's something that can persist.
But are these lasting damage, or are these just lingering symptoms?
So that's where it's too early to tell. We know it can last at least up to a year from the folks that we spoke to who still have it a year later after their original COVID infection. The question is it going to continue for year 2, year 3? And nobody knows, right? Because this is such a new virus.
And I'll tell you the other thing that worries me that gets very little press, I think somebody alluded to it in the comments here, is kids. Kids weren't as at risk of getting the deadly version as older people were, particularly with pre-existing conditions, diabetes, heart conditions, other sorts of things. So we tended to think, up until now, we have not vaccinated children. A couple of countries have. Israel has. I forgot a couple other countries have vaccinated children, but we have not. And in fact, people have risen up in numbers at board meetings. Don't you dare make my kid get a vaccine. We vaccinate them for all sorts of other stuff, mumps, measles, and rubella, the MMR one that every kid has to have, and other things. But we have drawn a line. A lot of parents, not all, but many have said, no way, ain't going there. If this is ever shown to have lasting damage, wouldn't it be even more important to have children vaccinated? Because we might find out, 10 years from now, 20 years from now, Oh, you had COVID? Oh, that's why you developed early onset something, heart disease.
Yeah, absolutely a lot of unknowns. Dr. Sagoon here from Canada, he's a Canadian ER physician, states brain fog is perhaps the biggest finding among COVID long haulers from our experience.
Okay. And I guess, but I'm going at that, I'm going to push one step further.
Yeah.
If COVID in general
Right.
has lasting damage on your lungs, on your heart, on your brain, somewhere here,
Yeah.
it doesn't, you don't just get sick and get over it. Maybe it takes a while, maybe it takes others longer, but it has lasting damage to your body in any significant way, in any significant numbers. I don't know if it does or doesn't, but if it does, aren't we putting our kids at risk and ourselves at risk by getting it?
Absolutely. Absolutely, 100%. A study was published last year, which is very interesting. And it was a study of patients hospitalized with COVID who had COVID pneumonia. Okay. COVID pneumonia is the number one reason we admit COVID patients is when they come in and they can't breathe and their oxygen levels lower than 90%, right? We do a chest x-ray and we see pneumonia, and we call that COVID pneumonia. So what this study did was they look at these same patients 1 year later. So you had your pneumonia, you're hospitalized. 1 year later, how did you do? Right. What is your current status? Right. And what they did was they did lung testing to evaluate their lungs and their lung function. And their lung function, we call it pulmonary function testing, right? Okay. Is the term we use. Right. You blow into this device and it measures your lung capacity and all that.
How long can you hold the little ball up and how much pressure you're generating,
so
and all that stuff,
right? And so among those who are hospitalized with COVID pneumonia, 1 year later, 30% of them have not regained their pulmonary function back.
Wow. That's
30% still had lung damage.
And we won't know for 5 years, 10 years, or multiple years whether that is permanent or whether it's just something that you got to work hard to get back. Did it permanently damage your lung, or is it just it weakened it so bad that you haven't regained your strength?
Absolutely. So we know at least a third of patients a year later with COVID pneumonia hospitalized have not regained their lung function. Hello, John from OC Hospices here.
Hey, John's on. Welcome, John. We got to do a shout out. John did a wonderful show yesterday. Wonderful show. On John's with the Orange County Hispanic Chamber of Commerce.
Right, Chamber of Commerce, yes.
They started a show yesterday, and he's the host of it. And hello, amigo, to you. Go check it out. They had Patty Juarez on from Wells Fargo Bank.
Nice.
We should have you on sometime to talk about things. I wonder if it's any different, John, in the Hispanic community as opposed to the rest of the community in the response to this whole crisis. Are Hispanics more likely to get vaccinated, less likely to get vaccinated? Are Hispanic businesses any different than any others? Are we all just angry and done? I wonder if John's listening there again. I wonder if he'd give us some response. What's it like what's the Orange County Hispanic Chamber of Commerce seeing? Any different response to this crisis in their community, in that community? I'd be curious.
Yeah. And again, I want to reiterate what we're seeing in the wastewater.
It's there. Go look at your P report. It's there. There's a P report.
P and poo report usually shows the underlying truth of what's coming later, but the P and poo report in our wastewater from February 20th or so to the March 10th or so, around there, 15-day evaluation of our wastewater is showing a 1,000% increase of COVID in the wastewater.
So what do you think's coming? You're like this annoying little voice that's saying it ain't over. And look around. You think it's done. It's not done. And I don't see anybody jumping up and down saying, Okay, let's take to the barriers. Let's fight. Let's gather the troops. Let's unite the people. Everybody's like, Dr. Trinh, would you just be quiet and quit talking? Would you just shut up? It's done. And if it ain't done, I don't want to hear about it anymore.
Yeah. Yeah, I mean, I feel the same way often.
Yeah.
I think we're all just emotionally tired from COVID.
We used to, for the first year, CNN would run reports. These are all the people who've died. We had daily death numbers like Vietnam when I was a kid in the American War, the Vietnam War, depending on what side you were on. Every night in the evening news, how many people were killed? How many people were killed? We had these kind of body counts all the time. I don't see the body counts anymore. We quit counting.
No, not at all. And the funding will, the HRSA funding dries up next week for those who are, who are unfunded, or for those who don't have insurance. The government funding will pretty much go away with that. John says he heard yesterday from a doctor that the younger mid-20 generation and younger will be hit hard with COVID in the next wave because many do not get vaccinated. True.
My Hispanic son-in-law among those, who is a bank manager, who kicking and screaming, finally got the first shot because his bank made him do it. But it says, ain't getting any more. No way. Not getting another booster. Don't need it. Overreaction. Not taking any vaccines. Can't tell me to do it. And just knock it off. I don't get it. I don't get that response. I don't understand why everybody wouldn't welcome
it. But who knows? Maybe they're right. Maybe this, Omicron baby hits us like a big wave, but nobody gets hospitalized.
Right.
That'd be the best case scenario, right?
But
that'd be the best case scenario.
But I'll give you one counter argument to that, and then we'll start wrapping up here. Okay, you're right. People don't die in big numbers because we have gotten treatments in place finally, and we can lessen the severity of it, and we can keep you at the hospital. Right. And this variant itself is contagious, but not as deadly. Or maybe it is deadly, but we've learned how to contain it quicker, and you get sick, but not as sick. Whatever it is, what we're all counting on, we still get sick, and that means you stay home. What does that do to our supply chain, to our stores, to our factories, when everybody is home sick again?
Oh, yeah. I mean, look at a few months ago with Delta. They didn't have enough nurses for the hospitals because the nurses were coming down with it. The docs were coming down with it. And it was such a big issue that the CDC came out with this political recommendation that if you're a healthcare worker and you got COVID, but your symptoms are mild, keep going to work.
Keep going to work because we need you. We're record inflation partly because factories shut down and you can't get the stuff. So everything's in demand, drives prices up. I know there's more to the inflation than that.
Right.
We put tons of money into the economy and other things, but that's part of it, is that the supply chains broke down. We didn't have stuff piled on the shelves, and so suddenly there's a shortage of everything. Doesn't that disrupt business? Is business just going to have to live with, we can't get labor right now, either because of the Great Resignation or other things. So isn't that just make the labor shortage shorter? Doesn't that make the lines get longer? Doesn't that have an economic impact? So if it's not political, if it's not moral, if it's not personal safety or community health, isn't it just common sense, business sense, that we don't want everybody getting sick even for a week?
Absolutely. Yeah. And John is right. Not a lot of people are talking about the burnout of folks in the medical field. I know a lot of folks who have left the medical field because of COVID, because they're burnt out. A lot of nurses are doing different things now, and docs. And absolutely correct, John.
Well, John works in hospice care, OC Hospice. We'll give him a shout out to his business. So they're there to help take care of you in your end of life situations. I think we should have John come on sometime and talk about end of life and how it's gotten even harder during COVID. I can't visit my loved ones as they're dying. I'm afraid I'm going to make others sick. The funerals with nobody there, the people who were isolated before who are even more isolated now. I think there is some under the iceberg. If COVID's like an iceberg and all we've been staring at is the tip, there is a bigger problem underneath. Medical care burnout, increased mental problems because of isolation and fear and anxiety, harder end of life scenarios because of this. I think there's something bigger that will take us a long time to realize and recognize.
Absolutely. And the one thing that worries me is that even if nobody gets hospitalized with COVID with this next wave, which is a great thing, right? Nobody ends up in the ER.
We hope that's
I just don't know what the number of long COVID look like.
Exactly.
With folks, because we do know that folks who have mild COVID can get long COVID as well. You don't need to have severe COVID symptoms to get long COVID symptoms.
Let me give you one example. I'll leave
That's
with this.
Yeah.
So when I was a kid in the 60s, and then as a young adult in the 70s in college, we had asbestos everywhere. It was in every house. It was in clothing sometimes. It was certainly in factories, brakes, and other sorts of things. I worked in a car factory during the summer in college, and we had part of it. They were putting brakes on, and I'm telling you, you could see it in the air. You'd walk through; it was coating the asbestos dust as they ground these things down, was just everywhere in the floor.
Mm-hmm.
And we didn't think about it. And I remember thinking, this can't be very healthy. I used to put a handkerchief and walk through it, but they didn't make you wear a mask or anything. And it took 20 years or more before they realized the effect of asbestos on the lungs, that people who had worked in shipyards, worked in car factories, worked in other things, in homes and stuff. Now we rip it out. They come in with hazmat suits. If they find out you got asbestos in your house, oh my God, they rip it all out carefully, because we didn't realize until 20 years later what a little bit of asbestos does when embedded into your lungs. I wonder if we're going to 20 years from now wonder, why didn't we pay more attention to COVID and its effect on our lungs and our hearts today? Why did we treat it so lightly?
Absolutely. And so it'll be interesting to see what happens in the next few weeks. My guess is in April, we're going to start seeing a spike again with COVID, with Omicron baby. It's already starting in the East Coast, in New England area, New Jersey, New York. We're starting to see higher cases now. Again, hospitalizations will track probably 3 to 4 weeks after the new cases, so it's too early to see really any major spikes in hospitalizations.
And yet right now, Orange County cases have come down, U.S. cases have come down, and that's why everybody's dropping mask mandates left and right and center. And the general feeling in America is we made it through the last big wave, and happy days are here again. We're heading into summer. Last question for you. Somebody had asked me, I thought if this, I know it's not the flu, but even Trump and others in the beginning felt it's going to act like the flu, meaning that when it's warm, nobody's going to get sick. The bug's going to get burned out and die. It's only when you're cold that the bug flourishes, and partly because people are indoors more and they're locked face to face, but we're outside and it's warm, and somehow we think that will save us. Will that save us?
Well, it may partially save us. And usually in the summer, there's less viruses. It just really depends on what this new variant is going to do over the next few months here. So we'll have to wait and see. But the warning signs are already there in the wastewater.
Well, based on what I'm seeing, ain't nobody watching the warning signs. I'm done watching that movie. Quit. You're not getting me to do anything again. And if it comes back, so be it. Everybody gets sick, and we just move on. All right. Well, thanks so much for at least warning us. I know that's part of the show, is to tell you what you're seeing.
Yeah.
You're always not doing it from a political perspective. You're just doing it from a data perspective.
Pretty much data perspective. Thanks, John, for coming on. And big shortage, John, of psychologists and psychiatrists to address the bereavement issues of folks who are recovering from so many deaths around us and the mental health.
Let's get
very
John.
important.
Let's get John on sometime and talk about that.
We will definitely, John. We'll have to get you on soon.
Okay. All right. Well.
All right.
Any final thoughts? Take us out, Dr. Trinh.
Final thoughts is let's continue to see what we can do to help with the refugee crisis over there.
Yes.
We have our partners over there, and thank you for those who have donated to Tongue Out. We've sent out a large sum of money yesterday over to Poland to help with the Ukrainians.
And my last word is, don't let it end there. If we can unite over,
Yes.
If we can find a common path forward over Ukraine to fight a common enemy, we can certainly find a common path forward to fight this common COVID enemy.
Absolutely. And my last thought is, look at the wastewater, guys. It's telling us something that's coming.
I'm gonna start measuring my wastewater.
Coming in the wastewater.
Okay. The secret is in the. They used to say follow the money. Now it's follow the pee. Follow the poo.
Follow the poo and the pee.
Okay.
We're seeing a lot of COVID in the poo and pee, and that's gonna eventually come to fruition.
All right. We'll keep tracking that. All right, here on this show. Thanks for joining us.
Yes.
Well, there you have it, folks. It may not be the message you wanted to hear this morning, but it not be over yet. We're going to keep tracking it for you here. Keep coming back with your questions and comments as we keep finding ways to keep talking about, even when you don't want to hear about it, what is our health like today? And what is the best way forward? Right here on Orange County's only community radio station, OCTalkRadio.net. Streaming live from our studios here at the University of California, Irvine, Deal Applied Innovation Center.